Welcome to my channel. In this video I will discuss about coma, what is coma, causes of coma, and how you can clinically evaluate this condition. So what can be different causes of coma? These may be infectious disorders. Infectious disorders include encephalitis like herpes simplex infection. Infectious causes can also include malarial parasite, that is cerebral malaria. Infectious causes can also be meningitis or any other severe systemic infection. Other causes are metabolic disorders like uremia, diabetic ketoacidosis, hypoxia, metabolic acidosis, hypoglycemia, and electrolyte disturbances. Other causes such as trauma include hemorrhages, where subdural and epidural hematoma and parenchymal bleeding. Other causes are poisoning, for example, poisoning with aspirin, poisoning with other drugs like organophosphates, poisoning with opiates, and other disorders like circulatory failure, that is shock, respiratory failure. These all can lead to this condition that is called tumors, seizures, heat stroke, and space occupying lesions can also lead to coma. Now, how you can clinically assess this condition? You can clinically assess this condition by taking a proper history, and then you can evaluate. But before taking history, make sure that patient is not in shock, patient does not have respiratory compromise, and there should be no area of bleeding if there is history of trauma, because when there is bleeding, first you should attend that bleeding, and then you should go for history and examination. In history, first you should ask when the comatose condition started. Then you should ask about fever. Why? Because it points towards infection. Then you should ask about jaundice, and you should ask about any metabolic disorder like diabetes or other metabolic disorder. Headache, vomiting. Vomiting is mostly projectile in especially the cases of raised intracranial pressure. History of any drug intake, because poisoning of certain drugs like opiates can lead to this coma condition. And then you should take history of any sunstroke or heat stroke, and you should ask about head trauma, convulsions, and any other disorder like renal disorders. Now we come to examination. First, the vitals should be monitored. These include temperature, because fever tells us about the infection, hyperthermia, meningitis, and heat stroke. Hypothermia suggests toxic shock or intoxication. Now we come to the respiratory system, in which we if there is slow breathing, then there are several causes of this slow breathing. For example, opioid poisoning, salicylate poisoning, any metabolic acidosis or alkalosis. Central respiratory failure is also a cause of this slow respiration. If there is deep sighing breathing, this is called Kussmaul's breathing. It is mostly seen in the diabetic ketoacidosis. And if the Cheyne-Stokes breathing is present, in which there are paroxysms of apneic conditions along with the hyperventilation, then it is seen in bilateral cortical damage. In increased intracranial pressure, there is atactic or irregular respiratory pattern. Metabolic disturbances lead direct to rapid regular breathing, that is increased in frequency. Now we come to pulse. If pulse is low, then it tells us about any increased intracranial pressure, and if the pulse rate is high, it means there is circulatory shock. Similarly, blood pressure is increased in hypertensive encephalopathy and decreased in conditions like shock, arrhythmias. Skin is paler in hemorrhage, and skin is cyanosed in case of low oxygen in the body. Hemorrhagic rash is present in case of meningococcal infections. Dry and hard skin is present in case of heat stroke, and there is skin dehydration also. Now we come to odor of mouth. Fruity smell is present in case of diabetic ketoacidosis, and in case of uremia, uriniferous odor is present, while in case of hepatic coma, the mousy odor is present. Then we come to CNS examination. In case of CNS examination, there are signs of meningeal irritation. Then we come to the pupillary reaction. In case of midbrain involvement, the pupils are mildly dilated, and these are non-reactive to light, while in case of opioid poisoning, the pupils are pinpoint, and these are actually meiosis of the pupil occurs. In case of atropine poisoning or in case of post-ictal state, the pupils are completely dilated. In case of eyes, we observe the extraocular movements. The sixth nerve palsy, that is the nerve that supplies to the lateral rectus muscle, is observed in case of raised intracranial pressure. Similarly, we do a test called doll's eye test, in which when the patient's head is rotated to one side, then the eyes try to focus on the distant object. But in case of brainstem injury, the eyes move along with the head when it is turned around. Then we examine the fundus, and on fundoscopy we can observe the papillae edema in case of raised intracranial pressure, as well as we can also observe the hemorrhages in case of severe hypertension. Then now we check the motor response. The person may be hemiplegic, there may be decerebrate posture or decorticate posture, or pontomedullary lesions are associated usually with no response to the painful stimuli. Now we come to the different investigations that we do for the diagnosis of this condition. These investigations include full blood count, lumbar puncture, blood culture. Blood culture is done for the diagnosis of bacteria. CT scan of the head, especially in case of trauma. Liver function tests. Metabolic screen should be done, for example detection of diabetes, and measurement of blood sugar, blood urea and serum electrolytes in the metabolic screen. And slide for malarial parasite if you suspect cerebral malaria, as well as EEG for, that is electroencephalogram. It is done if the seizure disorders are present. Now, how you can manage this condition? Management is simple. If the underlying cause is known, then the underlying cause is treated before giving the sportive measures. And if the underlying cause is not known, then only the sportive measures are given. These sportive measures include maintenance of the normal temperature, that is hypothermia and hyperthermia should be dealt according to. Maintenance of clear airway and give oxygen to the patient. Patient should be in the semi-prone position so that aspiration of the contents should not occur, and suction should be done continuously. Then in case of shock, you should give the IV fluids so that the shock should be coped, and in case of hypertension, you can also give fluids, while in case of severe hypertension, you can give diuretics. Convulsions should be controlled by giving any anticonvulsant like midazolam. Then you should give mannitol if the intracranial pressure is increased. Nutrition should be given through NG tube, and the patient's side should be changed on the bed after every half an hour or after every hour, so that bed sores should be prevented. Care for oral hygiene should be done, and there should be no bladder distension by using Foley's catheter. Then you should care about the bowel, and you should prevent the infection of the stools. Monitor the ventilator, and physiotherapy should be done to prevent the contractures. So this is the general management and general review of the coma. So thank you for watching.